This is the dressing change for PICC lines and central lines. Gather the appropriate supplies. Central line dressing change kit, clean gloves, hand sanitizer and a mask for the patient. Perform hand hygiene before entering the room and don clean gloves. Explain the procedure to the patient and clean the surfaces with Sani wipes prior to changing the dressing. Perform hand hygiene and don clean gloves. Open the kit on the clean surface and remove gloves and mask, maintaining asepsis. Set the gloves aside, outside of the sterile field. Don the mask for you and your patient. Remove the dressing by pulling towards the insertion site. Remove secure device per manufacturer instruction for use, maintaining control of the catheter, if applicable. Assess the site for any signs of infection, drainage, and take note of the external length. Remove and discard the soiled gloves and re-perform hand hygiene. Using sterile technique, don the sterile gloves. Take the 4x4 in the kit and hold on to the central line. Cleanse the skin with aseptic solution, the CHG wipes, back and forth vigorously for 30 seconds. You can take the 4x4 and hold on to the central line to remain sterile. Allow this to dry completely. 25, 26, 27, 28, 29, 30. After it is fully dry, apply skin protectant. Apply secure device if necessary. Apply the bio patch. Make sure that the writing is up and that the circle fully encompasses the line. Once it's in place, slightly turn it. Apply dressing to cover the insertion site and catheter bifurcation. Once in place, lift the catheter up and place a strip to completely seal the dressing underneath. Take the other strip and apply that on top. Hub maintenance for PICs and CVCs. Once again, gather appropriate supplies. A pre-filled syringe, injection cap, needleless connector for each lumen, antiseptic wipes containing alcohol. Explain to the patient what you are about to do. Perform hand hygiene on entry to the room and don clean gloves. Open the package and attach the saline syringe to the injection cap. Maintain sterility of the syringe tip. Prime the needleless connector with the saline. Before accessing the hub, connectors or injection ports, scrub with alcohol for 5 seconds with a vigorous twisting motion. Allow to dry for at least 5 seconds. When replacing the hub, scrub the injection cap and catheter hub with appropriate aseptic agents. Allow to dry completely. Clamp the catheter if necessary. And remove the cap. With a clean alcohol swab, clean the cap of the hub for at least 5 seconds and let dry for 5 seconds. Remove the protective cap from the distal end of the injection cap needleless connector and attach it to the catheter hub. Unclamp the extension and verify blood return. Flush the intended lumen with 10 cc of normal saline. Use pulsatile technique. Never reuse your saline syringe. Perform this on each hub. This is for medication administration or flush for a PIC or CVC line. Gather appropriate supplies, 2 pre-filled syringes with normal saline, antiseptic wipes containing alcohol, medication in the syringe, and clean gloves. Educate your patient on the procedure, wash your hands, and don your gloves. Before accessing the hub, scrub it with alcohol for at least 5 seconds and allow to dry for at least 5 seconds, even if the hub has previously had a Kuros cap attached. Attach a pre-filled 10 cc saline syringe to the needleless connector, maintaining sterility, and verify blood return. Once you have established blood return, using pulsatile technique, flush with the 10 cc of normal saline. Remove the syringe, take a clean, new alcohol swab and clean the hub vigorously for 5 seconds and allow 5 seconds to dry. Using aseptic technique, administer medication by connecting the medication syringe. Push the medication per recommendation. Remove the syringe. Take a new alcohol swab. Clean vigorously around the hub for 5 more seconds and allow to dry for at least 5 seconds. Attach a pre-filled syringe with normal saline and flush 2 to 3 cc's of normal saline, and then use pulsatile technique to flush the rest of the saline. If the medication needs more than 3 cc's of flush, use a separate syringe to flush and a separate syringe to use pulsatile technique, all the while cleaning with alcohol in between each syringe removal. This is blood draw for PICC or CVC lines. Gather appropriate supplies. 3 pre-filled 10 cc saline syringes, all blood tubes or empty syringes necessary for obtaining a waste and for the blood samples themselves. Alcohol swabs, clean gloves and labels for tubes. Perform hand hygiene and enter the room. Don your gloves. Verify patient identity using 2 forms of identity. Explain procedure to the patient. Prior to any blood sampling, all infusions should be stopped. Before accessing the hub, scrub with alcohol for 5 seconds and allow to dry for 5 seconds. Attach a pre-filled syringe, maintaining sterility, and verify blood return. Flush the syringe with pulsatile technique. Remove the syringe, use a clean antiseptic alcohol swab and scrub vigorously for 5 seconds and then let dry for at least 5 seconds. Attach an empty syringe. Withdraw waste 5 cc's for adults and 3 cc's for children. Remove this syringe and discard. Take a clean alcohol swab and scrub for 5 seconds. Allow to dry completely for at least 5 seconds. Attach a clean syringe using sterile technique. Obtain the blood sample as ordered. Remove the syringe and give to lab. Clean the hub with a clean alcohol swab for 5 seconds and allow to dry for 5 seconds. Attach a clean pre-filled normal saline syringe and flush vigorously with pulsatile technique. Transfer the blood specimens from the syringe to appropriate blood specimen tubes if lab is not available. Label all the blood tubes in the room. Discard the supplies. Remove the gloves. Perform hand hygiene and document your procedure in the patient's records.